The following program was produced by PAC TV in accordance with the agreements PAC TV has with the towns we serve. The content of this program does not reflect the views or opinions of the PAC TV staff or board of directors.
Hi, welcome to Healthy Kingston. My name is Janet Wade. We've all found the last 6 months to be challenging, stressful, and frustrating due to the coronavirus pandemic. Some of us have been exposed, some of us have had the virus. Unfortunately, some of us have probably known family and friends who've actually succumbed to the virus. Suffice it to say, it has been a tremendously challenging time for all of us, and it has changed our lives dramatically, and they will never be quite the same again. Today, we will be having some local health experts who will be talking to us further about what has been done for the residents of Kingston in regards to preventing the spread of the coronavirus here in Kingston. But before we get into that, I do want to tell you a little bit more about the program. We will be hearing from our health agent, Arthur Boyle, who will be telling us about additional public health issues that have been going on in the town, including Triple E, as well as the influenza season that's going to be coming upon us shortly. I also will be welcoming Heidi Whipple, who is our newly elected member of the Board of Health, and she'll be telling all of you a little bit more about herself. And then lastly, I'd like to take this opportunity to acknowledge Tom Watson, who's been a tremendous asset to the Board of Health the last 15 years. I know personally, I will certainly miss him. We all will. I've learned a lot from him and wish him well on the Sewer Commission. So Tom, thank you so much for your dedicated work to the town of Kingston. And everyone, I want to introduce Heidi Whipple, who is our newly elected member of the Board of Health.
Janet, thank you so much for having me this morning. It's nice to see you again, as always.
So if you would, could you tell us a little bit about your background?
So my background is I graduated with a bachelor's degree in nursing from Simmons in 2001. I then proceeded to work up at South Shore Hospital here in Weymouth and worked there for a couple of years in pediatrics. I then came to what was then Jordan Hospital, which we now know as Beth Israel Deaconess Plymouth, into their emergency department. I was there for almost a decade. And then I did some labor and delivery, and currently I'm a case manager. The case management job really engages you within the community. You have the time to talk to the patients, figure out what their needs are. And I spend a lot of time with our senior patients within town, engaged in the hospital. So I'm able to figure out what needs might be for them. I'm able to find them resources that they might not be aware of. When I first started my campaign, we weren't in a pandemic. It wasn't happening yet. Right. So right at the forefront of our minds is this pandemic and the need for people to continue wearing their masks and washing their hands. Kingston is doing a fabulous job. Our numbers are nice and low. I'd like to see them stay low, especially with the anticipated resurgence this fall. So that's what I'm truly invested in right now. My reason for coming to the board was that I wanted to help Kingston have a more proactive approach. I wanted to be able to make problems not occur. Let's see if we can help eradicate some diseases and, keep Kingston healthier. Let's work with people with their diabetes, with their congestive heart failure. Let's keep our seniors active. Let's keep our kids in school active. They need to be in gym classes. They need to be running around outside fresh air. There's so much focus on screens. And I really feel this is a focus too right now where we're coming back into a hybrid model of school. And these children are going to be in front of computers 3 days a week. We need to make sure that they're really engaging in getting some exercise and eating good foods and just being healthy.
Well, we're really excited about having you on board. Thank you so much for sharing your time. Arthur, I'd like to introduce you. Again, it's been 6 months, but have you update us?
Second year.
Yes, on what's been going on the last 6 months with the Board of Health.
Well, COVID-19 has been going on for the last, well, since March it's been, and we've hit the wall and come down quite a bit. I credit Governor Baker with standing firm with his unrelenting, keep the mask on, keep your distance, and it's worked. And it just shows in the other states where it hasn't worked that they have done things the way that they're not supposed to do them. Governor Baker, and I'm not speaking to him as a party member or anything. I just think he's done a terrific job, and I think
I have to
we've
agree.
made some errors along the way, but you have to give him credit. He's taking a chance. He's standing out there, and they said he put his chin out for the press to punch him. He's taking every shot. So
Right.
he's a well-organized guy, and that's something that we'll talk about. Organization. We'll talk about the emergency management team. But for now, let's basically we've got Triple E on the horizon. We had our first youngster in Plymouth bitten by a positive testing mosquito. We've had a couple of adults in Kingston. We are on the high risk scale now, and that puts us in with Carver and Rochester and a few others. And that's an uncomfortable place to be, given that we've got probably 6 weeks of summer and Indian summer to go.
So what would you tell people? I think everyone's fairly well acquainted with it in the town, but what to do as far as preventing themselves from being exposed or having the children exposed?
Well, as you know, we put out a directive to the schools and the parks and the recreation about closing the fields down 15 minutes earlier every week for the month of August, so we can get them shut down in September by 6 o'clock, so that all our kids are off the fields and they're able to go back and play the next day. But there'll be a lot of changes with the COVID situation. I think particularly recreational sports, there'll probably be no high school football as an example, and the little league, the small the baseball players will probably miss some experiences because they're not going to be able to play until 8 o'clock at night. They're going to have to get off the field by 6 or 4 or 6. And we did it as a board. It was in the public's best interest. It was in the interest of public safety. And I think we did the right thing. I think if we look back at this 10 years from now, we're going to say the governor did the right thing when he had to, and the Board of Health did the right thing when they had to. And Dan, I give you a lot of credit. This is your second year of Healthy Kingston, and you've made a mark on the community already because it's a great vehicle to have, to be able to talk locally to your health agent, your health board members, and so forth. So I think you deserve a lot of credit.
Great. Well, thank you. Thank you, Arthur. I appreciate that. Do you want to speak at all to the latest discussion as far as everyone receiving the influenza vaccine, particularly children going back to school?
Yeah, I've heard that news like everybody else has, but I haven't seen an official document come across our desk yet, and I expect that we will. We could see it today, we could see it tomorrow, we could see it a week from now. But I think the flu vaccine for the typical flu that you'll get in September or October or November, I think it's wise for everybody to take a flu shot now. I can't see any good reason not to, aside from the medical situation, which the doctor would have to consult on. But we have the opportunity to take the flu shot, and they're giving it away on street corners practically. I mean, every CVS and Walgreens and Rite Aid and a lot of the Council on Aging and the Nurses Association, they've all got ways of getting you the flu vaccine. If there happens to be another one for COVID that comes along in January or February, I take that too, because that's a solid bet. We've had, it's interesting, in Plymouth County, there's been 9,380 positive tests with 783 deaths. And that's a pretty staggering number.
Yes,
We've
definitely.
been fortunate in terms of percentage, we think it has been lower than the average. And that, I think, is a credit to the Board of Health. Joe Kasner has led the fight to, keep people informed and keep the situation in the forefront so it doesn't get swept under the rug. And,
Right.
It's been a good effort, and it shows that the town cares because they're lower than a lot of the communities around them.
Right, exactly. Well, and just adding to the what you were talking about as far as the flu vaccine goes, that at the moment with so many people staying home and sheltering in place, it's led to a number of people who aren't going to their routine preventative medical services. So again, I think that's why they're stressing that people do go out and get the flu vaccine this fall, even though they are sheltering in place, because it's important that we all make that effort so that that doesn't become a major issue this fall along with COVID.
No, I think it'd be wise too to tell folks to, get in line as early as possible for the flu shot, because it's going to be
Right.
a very popular thing to have happen in September and October and November. And
Right.
you don't want to find yourself standing in the back of a long line and waiting for a flu shot.
Exactly. Okay, right now we're going to be talking a little bit more depth as far as what the town has been doing for the residents in relation to the coronavirus pandemic. Before I do start this discussion, I do want to start it with a few basic statistics, which are very, very sobering. In the United States currently, that is as of today, there have been 5,072,000 cases and 177,000 deaths. In Massachusetts, there have been 125,000 cases till now and 8,921 deaths. And as Arthur had mentioned, right now there have been 145 confirmed cases in Kingston area. I know we probably all more than familiar with the symptoms, but they certainly bear repeating. Unfortunately, they're very common, and they're common to the flu and other infections, but it's important that you become familiar with them. Fever, chills, cough, shortness of breath, chest pain, fatigue, muscle aches, congestion, a runny nose, nausea and vomiting, sore throat, and loss of smell or taste, and headache and diarrhea. All of these, a number of them are very common, but they're things to be looking for, and particularly if you have them simultaneously. Definitely, you should seek medical attention if call 911 or get to your primary care or an emergency room if you have serious breathing problems, shallow breathing, bluish lips, chest pain, severe chest pain, confusion, and an inability to stay awake. All of these are very serious symptoms and warrant being seen immediately. So right there is how I want to start the conversation. And again, I'm going to introduce Arthur Boyle and also Deputy Fire Chief Adam Hatch, both of whom from the very inception of COVID-19 have had very vital roles on the emergency management team for the town. So again, thank you both for being here, particularly Deputy Hatch. We know you're a very busy man, so thank you for being here.
No problem, Janet. Thank you.
So first off, what is this emergency management team and how did it even get started?
Well, the emergency management team came about, we've always had a role in emergency management per se, but this past spring, right when the pandemic started, the team was convened. And at the time, it consisted of the fire chief and myself, the police chief, streets, trees, and parks superintendent, some members of the board of selectmen, town manager. And then we kind of plugged in any department head, a representative of a department that may have a dog in the fight, so to speak. You know, there were times where we certainly worked quite closely with the Council on Aging, the rec department, the library. So basically, as we went through the phases and it involved certain other department members, department heads, they were brought in on board. It's been scaled back quite a bit now that we're in the phase 3 and we're kind of in the soft reopening portion. So it's not as robust of a team, but it certainly can be built out as needed.
Can you tell the residents like where you started and how you've come up, how you progressed to this point at phase 3?
Well, basically what we did was we tried to stay consistent with what the governor was putting out. And that's what we based everything on, is what the state was telling us that we should be doing. So when everything was shut down right at the beginning, we kind of looked at what the essential functions would be to keep the town running as best we could, and worked along with other department heads. We worked closely with Town Hall. Granted, it was closed to the public, but some of the vital functions still kept going, albeit they were a little slower. So when we were able to reopen, we weren't playing catch up as much as maybe some other towns were. So basically, to answer your question in a short version, we basically just mirrored everything that the governor was asking us to do, and then kind of tailored it to the specifics of the town of Kingston.
Okay. And you mentioned a couple of times to the important functions. What were those and what do you see them as now?
Well, some of the things that we tried to keep doing was, as I said, keep some of Town Hall open, at least so the daily business of the town could be continued. We do a lot of, as far as the fire department's concerned, we do a lot of inspections for people buying and selling homes, and understanding how stressful that can be for somebody. We took a very short, and when I say short, maybe 2-day break where we stopped doing them until we could come up with a virtual online format so we can continue doing these resales for people so they could get on with their lives, so to speak. So it was things like that we kept trying to do. And obviously our emergency responses, we didn't waver on those at all. We still rolled out the door every time we were called, just like we did before the pandemic. So that was never an issue.
Okay. Arthur, feel free to chime in here because I know you've been certainly a significant part of this. What do you see as the important issues right now and what should be being emphasized, to the both of you?
We have signs all over town. We have signs all over town that talk about EEE, and they're on the library, and I want to thank the new librarian Mike for his cooperation in getting it out there. But to get back to the COVID issue, I mean, that's not going away, and it's going to get worse, they say, in October or early November. So we've got our work cut out for us in terms of keeping people informed and letting them know the dangers of certain behaviors. And there are people that are trying to do things that they're not supposed to do yet. And, the state of the town will catch up with you eventually.
Mm-hmm. Okay. Deputy Fire Chief Hatch, what would you say, what are some parameters you think residents should be using? What should they be doing to prevent themselves from spreading the virus?
I'd have to agree with what Arthur's saying is, the rules and regulations that the governor has put out, although they can be frustrating, they seem to have worked. Overall, as a state, we were doing pretty well, same as a town, compared to some other towns. So we just need to continue to be vigilant. We need to continue to realize that this hasn't gone away. And it may very well rear its ugly head again in the fall, and we just have to be prepared for that. And I think we are prepared for that because we've been working so closely together and communicating so well. We're all on the same page.
Great. So signage out there, remembering everybody should wear masks, social distance. You're not only protecting other people, you're protecting yourself, your families, your friends, your children. That all of that is really key to hoping to deter the spread, and finally we can get beyond this.
And
What
you're
about
allowing the big
restaurant?
events.
What's that?
You're allowing the big events to take place. You're allowing the Kingston collection to open up, and as it has, and not all stores are open yet. But
Okay.
they've done a good job of getting the public informed and having everybody wear a mask when they come in. And, to the credit of police and fire, they have done a great job in spreading the word as well, because the only way we're going to beat this back is to do it right. And again, I go back to what Adam said, that the governor took the lead, and we've been very lucky so far.
Mm-hmm. And the restaurants seem to be cooperating, and the
They
stores, which is great, with masks and outdoor eating. So what about phase 4? Does that seem to be coming around the corner yet, or we're just going to hold into 3 for a while?
Well, I thought the light was at the end of the tunnel, but it seems now like it's an oncoming train.
Yeah. So we'll just wait and see.
Yeah, we'd be speculating in total to say when it would happen or if it would happen. There are still some businesses that are closed, and we'll know it's a good sign when they start to open as well. The big movie theaters and the kids' entertainment facilities and things like that.
Right. Deputy Fire Chief Hatch, do you have any closing comments you'd like to make from your perspective, things you'd like to remind people of?
Just to kind of echo what we were talking about earlier, I think we need to, as a community, stay vigilant and remember that even though things have gotten a little bit better, we can't have false senses of security. We still have to keep pushing forward and being careful and doing all the things we've been doing for the past few months, however frustrating they may be. So we don't fall, don't take 10 steps backwards, as everybody seems to think may happen. We just got to all continue to do our part and keep pushing forward and understand we're in a different time now, and we don't really have the answers as to when this may all be gone.
Right. Good words. I do want to draw everyone's attention to the health department website. On it, you can get information about where to go for COVID testing. So that's important. Also, there's a relief fund list so that people who are unemployed, who are having financial problems, who are in the military, who are having issues with accessing food, nutrition, there are all websites there that'll give you information as to how you can get help. Also, there is a hotline for people having mental health. I think we're all having mental health issues to some degree, vacillating between anger and depression and frustration and hopelessness. But mental health or substance abuse problems are very, very real. And there is a hotline that you can take advantage of, and you'll have the number on your screen. You also have it on the town health website, but it's 877-382-1609, and it's 24/7, 365 days a year. Also, unfortunately, domestic violence is an issue, and even more so during this stressful time. So there's a Safe Link number for people who need help in that area, 877-785-2020. So please take advantage of these resources that are out there. Certainly don't hesitate to look at the Board of Health website if you have any questions. It addresses a lot of questions that you might have, and certainly there's always calling the Board of Health. Gentlemen, thank you very much for your great information for our residents today. Everyone take care. We'll see you next month, and be safe.